Welcome. I'm Fabiola Molina, a physiotherapist and expert in non-invasive neuromodulation NESA. Today, I'm here to talk about the case of a 32-year-old patient with ankylosing spondylitis. This patient came to the clinic after hearing about improvements in various aspects from other patients, with their primary symptom being pain. They suffer from severe joint pain throughout the body, especially in the lumbar and sacral areas. We considered a general treatment plan to improve their mood, anxiety, sleep quality, and thereby alleviate their painful symptoms. Ankylosing spondylitis cases have a peculiarity. During the first week, the first 2 weeks of treatment with NESA, patients will experience body discomfort and fatigue above normal levels. This means we have to warn the patient that they will feel tired and their symptoms may exacerbate when starting this treatment. So, after discussing with the patient, we decide whether they want to proceed with the treatment or not. Fortunately, this young woman decides to undergo treatment with us. Indeed, during the first week, we start with a P1 program for half an hour, then a P7 and a P8 program, observing how in the first week she comes 4 times, then 3 times in the second week. She indeed starts to feel extreme fatigue and a sense of her body being beaten, which she logically associates with what we had warned her about. This is why it's important to communicate with the patient and inform them about what to expect. By the second week or mid-second week, from the 4th or 5th session, she begins to notice an improvement. The painful symptoms start to disappear and she experiences a significant reduction in joint pain. She also begins to walk differently. She had a characteristic gait of someone with neuropathic problems. A fatigued walk where she dragged her feet slightly, but now starts to walk differently. Additionally, her mood significantly improves. She goes from being somewhat depressed due to her situation to feeling more spirited for her daily activities. Besides, her sleep also starts to improve. How did we achieve all this? We began with some central general programs. AP1 for half an hour, AP7 for 15 minutes, and AP8. Then we started to direct the electrode to the manubrium of the sternum. Why? Because ankylosing spondylitis is a rheumatic disease that involves inflammation. One of the main organs in the body that regulates systemic inflammation is the vagus nerve. The vagus nerve controls the inflammatory cytokines we have daily. So, if we manage to improve the vagal tone, we can achieve significant improvements in these rheumatological diseases. We apply an electrode to the vagus nerve with a 2 15-minute program and a 7 45-minute program. 2 is for the ventral part of the vagus, which is what interests us. The dorsal vagus in humans is not as developed as the ventral vagus. This application during the sessions from the 4th, 5th, 6th session starts to take effect on the patient, and this 32-year-old woman begins to improve. She completes the first 10 sessions much more frequently, and from the second set of 10 sessions, we start doing them twice a week. We have to understand that this type of case is not going to be easily resolved because it is a disease. We are not going to solve the disease, but we are going to try to improve the quality of life of the patient so they can carry out their daily activities much more easily. In this way, you can see how different diseases, not only orthopedic but also with a slightly more complex component, can benefit from modulation of the autonomic nervous system. I hope this information has been helpful and I'll see you in the next video.